Good afternoon, everyone, and welcome to the 111th week of the Flint Community Webinar on Coronavirus. We're so excited that you've joined us today, and we have an exciting opportunity for you to learn some more about what's happening in our community around the coronavirus and related issues. We want you to know today that this webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I'm Yvonne Lewis, and I am excited to be your moderator today. A lot of excitement going on because I've been traveling across the country, and it's really interesting to see all the things that are going on. So on behalf of the Healthy Flint Research Coordinating Center as co-director, I want to invite you to join us today and put your questions in the chat as we're going forward. We appreciate all of our partners who joined us for these 111 weeks, and they continue to grow. We have additional partners that have joined us periodically. So we want to thank all of our partners for being available to you today. Many of our partners are here as panelists today. I see panelists from the Genesee Health Plan, from the Greater Flint Health Coalition is here. We also have Genesee Health Systems, and the list goes on. Michigan State University, University of Michigan. So if you have questions, please feel free to put those questions in the Q&A for us today so we can answer those questions for you. We also want to let you know some of the other topics that we're going to be covering today. We have some special guests. They've been here with us before, but they're back with us today, representatives from the National Resource Defense Council, who will be sharing information with us about the Flint Water Pipe Replacement Program. We'll also have conversations about the REACH initiative, Racial Ethnic Approaches to Community Health initiative from the Greater Flint Health Coalition. And of course, we've got a great medical moment coming your way today, as well as representatives from the City of Flint and the Genesee County Health Department to give us updates. We're going to have a little conversation this morning about a topic that's really, really important, because we want to talk about getting prepared for your continued decision making around COVID. This month, we started off with it being April, Minority Health Awareness Month. And I want to just share this with you, and I want to read it so I get it right. April has been designated as National Minority Health Month. And this year, the U.S. Department of Health and Human Services, Office of Minority Health, and its partners are highlighting the important role, and this is important, the important role of individuals and organizations and what we can do in helping to reduce health disparities and improve the health of racial and ethnic minority and American Indian Alaska Native communities. The theme for this year, as we've mentioned to you, is Give Your Community a Boost. Although the theme focuses on the continued importance of COVID-19 vaccinations, including boosters, as one of the strongest tools we use to protect communities from COVID-19, which has been disproportionately affecting communities of color. And we talked about that early on, why the data was so important. We're going to get a little bit more into the race data this afternoon as well, particularly looking at Black or African-American, Hispanic or Latino, and American, Indian or Alaska Native people are at greater risk of getting sick, having more severe illness, and dying from COVID. So we're encouraging you, help us, give our community a boost. This also supports many other activities happening in our community and across this nation to address the importance of health equity. So as we get into this conversation today, I hope that you're going to listen carefully as to what you can do as an individual, but equally important is what we can do as our organizations and collective communities to make a difference. As I mentioned to you, I traveled a little bit this week, and I was, thank you, Heatherlyn, for holding down the reins for us last Friday. Didn't realize I had my hand raised, but wanted to just make sure that as much as possible we could be supportive. So I'm going to ask our panelists. I'm asking Dr. Susan Wolford. I'm asking for Kaylee Blaney from the Health Department. We're also going to be looking for Dr. Reynolds to come and join us, and Nurse T, join us in this roundtable discussion. We want to just spend the next couple of minutes talking about preparing, decision-making during COVID. And I want to just start off with you, Katie, from the Health Department perspective. Can you just give us some tips? I know, as was mentioned last week and over the last couple of weeks, the language is changing. And we're also talking about, moving from a pandemic to recovery, but we're still in a pandemic. So what are some of those considerations from the health department perspective we should have as we're making these decisions over the next few weeks?
Yeah, terminology is definitely changing, and a lot of this is becoming personal choice and personal health decisions. And it's very important when you're taking those considerations to be speaking with your family, speaking with your doctors, and figuring out what are the best decisions for you. And right now, if you're over 50 years old or if you're immune compromised, you're able to get a booster dose, and looking at if that booster dose is right for you and when the timing of that would be right for you based on when you're eligible, and also potentially any medical procedures or things that you have coming up. And then always considering whether masking is the right option for you at this point in time. Right now, if you're trying to protect yourself, the best masking option for you is a KN95 or better mask. Those protect the wearers a lot better than, say, the cloth masks, which are better for source control options. But if you're trying to protect yourself, those KN95 masks or better are what is going to protect you individually. So it's very important in this recovery phase to make sure you're good with the personal health decisions that you're making. If wearing a mask makes you more comfortable, wear that mask. If there's certain situations you feel better in and you don't want to wear one, great. If there are certain situations where it's very crowded and you feel that a mask is the best option for you, then that's absolutely the decision that you should consider and that you should make.
Thank you, Katie. And I know, Dr. Reynolds, you always tell us to be mindful, use our brains, use our own ability to think through these processes. And so here I'm asking you again, you say, and I'm going to just say the first part of this, vaccination is the foundation
for the prevention of complications from infection.
And I appreciate the way you said that, prevention of complications, because early on, we got the impression that if we got the vaccination, we wouldn't get the virus. So help us out there in terms of, again, making good decisions.
Well, it has been shown over and over again in the past 2 months that despite having these variants, being vaccinated reduces the risk of hospitalization, reduces the risk of being in an ICU, reduces the risk of being put on a ventilator, reduces the risk of death. And these are important, and we have vulnerable populations. If you are over 60, you are at high risk. If you are pregnant or thinking about getting pregnant, you are high risk. If you have a chronic medical condition, you are high risk. If you had an organ transplant, and I know I say this every week, you are at high risk. If you are immunocompromised or immunosuppressed due to cancer treatment, you are at high risk, and you must conduct yourself accordingly. And so we have a toolbox of things to do. And Ms. Blaney referred to one, and that is get vaccinated. That's still the foundation. Number 2, wear a mask. Number 3, physical distancing. Number 4, wash your hands. Number 5, listen to accurate, credible messaging. Not what you hear from your cousin down the street, or what you hear on talk radio, or what you hear on YouTube. Look for credible sources. And it's not always clear initially, because if you look, the FDA will say something and then they will straighten it out later on. The CDC will say something which does not invalidate what they're saying. What it is as we learn more, we do better. And so we have to be open to change, because as we've said maybe 110 broadcasts ago, this is our first pandemic, and we are learning too. And we did not invest enough in public health to have the foundation and the tools to respond to chronic conditions. And we definitely weren't ready for pandemics.
Thank you, Dr. Reynolds. And when you talk about the chronic conditions and in the background a little bit, there's CDC, and there may be changing some things because there is some science associated with this. So I asked Dr. Wolford, because she is a scientist, though she's working with these babies, she's doing it from a scientific perspective, always talking about the research and needing to have valid information. So Dr. Wolford, how about understanding the science, how to make decisions based upon what the science is saying to us, even when things are changing?
Hey, Yvonne, thank you so much for that question, because it is so vitally important to be able to look at the science and how it's changing. And I want to get to one of the things to emphasize, one of the things that Dr. Reynolds said about whether you're at higher risk. And yes, many of the illnesses that he mentioned, absolutely, I agree wholeheartedly. And I'd like to emphasize that many of us don't think we are at increased risk, but the science suggests that if our BMI is higher than 25, that we are at increased risk. That if our blood sugars are not under good control, that we are at increased risk. And so many of us don't even know where our blood sugar runs, right? So we don't even realize that we are actually at increased risk. So I think we should, knowing that, now that the science has shown us that, we have a role to play. We have to visit our doctor. If we don't have one, get a doctor and find out, is our blood sugar high? Is our blood pressure high? What's our BMI? So that we can respond appropriately. And I'll say that I traveled this week and I was on a plane, and I think only about 20% of the people had masks on. So I had on my K95 and I did not, my KN95, and I did not take it off until I got into the rental car.
Yeah. Dr. Wolford, I've watched, when I was on the airplane last week, it was really clear that the mask mandates, some people were very happy that they didn't have to wear it, but there were a few of us, a significant number of us that still had on a mask. After I got out and I got into the streets, it was a totally different picture. So I could count the onesie twosies. And so that's been the experience over time. So having that understanding that we have to be careful about our own health and well-being and make decisions that are best for us is always a constant thought as we're becoming more aware of what's going on. And I want to just thank you for that, Dr. Wolford, and jump over here to Nurse T. Because Nurse T, we've talked about the science, we've talked about CDC, and we've talked about credible messengers. You're out in the community as a representative of Hurley, a nurse for a long time. But I've heard you say, let me break it down and keep it real. So how do we take some of this scientific, what do you say to people when you're out there talking to them one-on-one and they give you their perspective of how they think this is going?
Well, I thank you, Yvonne, for this opportunity. I always encourage people to activate their healthcare power. I always tell them that the power of decision starts within. And that even though a lot of people sometimes don't think that the vaccination is significant, it is, because it's an extra layer of protection, as everyone have said. And then now looking at the community, talking about the chronic medical conditions and people, a population of patients or people or community residents that we know that are at high risk. We also have a lot of people that's at risk in general. Like I also work with Michigan United as a lead navigation RN helping with vaccinations. And so what we started doing was taking blood pressures. So probably out of about 50 people's blood pressure that we took, 48 of them were borderline hypertensive. So a lot of the community residents, I don't know whether it's a result of having COVID or being exposed, but a lot of our community's blood pressure right now is extremely high. And a lot of people didn't even know that they had high blood pressure. And some of the residents that we took, these were quote unquote healthy people that exercise and eat right. So right now, what I'm saying is everybody is at risk. So we really got to be mindful to continue to protect ourselves and others and seek our healthcare professionals, go to the physician and get some physical exams so you'll know where you are. Because I can say the median blood pressure that we was taking, and everybody was ranging 130 over 90.
And the best or optimal blood pressure should be around?
It should be 110/70 or 120/80. And
So
then we know that we have a high increase amount of stress and anxiety. And you know, with hypertension, it can lead to heart disease, it can lead to stroke, it can lead to kidney disease. So it's just, I know they're saying that we're in recovery, quote unquote, but this is not a time to relax. This is a time to pay attention to everything.
Thank you, Tanisa, because COVID, as I say, it just simply, COVID is real and it is still at pandemic levels. So we really do need to think about what we can do. And it's not, you know, sometimes we used to use the term blaming the victim. This is not blaming anybody right now. And I hope we can really kind of work on this language a little bit. It is now an opportunity for us all to learn, take the individual responsibility as necessary, but we also need to work collectively as a community so that our community can be whole. So thank our panel. I got to thank you as we rush on to the next place in our conversation today. I appreciate you. I do want, Kaylee, can you just come back for one quick minute? I do need you to address this issue of testing for both flu and for the COVID, and then we're going to shift.
Yeah, absolutely. So one of the biggest pieces of confusion out there right now is the rescission of the original COVID test by the CDC. The CDC didn't use the greatest terminology. They said that they were pulling the test because it was unable to differentiate from COVID and the flu, which is true because that original test only tested for COVID-19. So when your nose got swabbed and that test was run, it would either be positive or negative, meaning you were positive for COVID or negative for COVID. So if you were ill and you tested negative, it didn't give you any additional information about what illness you might have. That test was pulled because the CDC is really trying to advocate for the use of what is called a multiplex test, a test that can test for multiple illnesses. The new test that the CDC is recommending is a test that with one nasal swab, you can test for both COVID and the flu, meaning that you have 3 potential options for results. You would either be COVID positive, flu positive, or you would be negative. So what they're talking about when they say differentiate is that this test would either be able to tell you if you have COVID or the flu. It doesn't mean that the last test, you would be positive for COVID, even if you had the flu. That's a common misconception. The last test would only be positive if you had COVID, but this new test will be able to tell you, okay, you're sick, it's not COVID, but you do have the flu. And that's what we're looking to move forwards to, is tests that even if you're still ill and you don't test positive for COVID, giving you more information about what illness you do have.
Thank you, Kaylee. Now, you chugged a whole lot for me in that short little bit of time, and I appreciate that. So I'm going to ask you next week, we're going to just kind of get into this a little bit more so it's clear, because these messages, we do want to clear them up so we're all able to make the best decision that we can.
Absolutely.
So thank you. Thank you so much to our panel. I want to move next. We're going to just spend a moment. Remember, I want to just highlight the important role of individuals and organizations can play or can be a part of in helping reduce health disparities. And one of those places is a project that's being facilitated through the Greater Flint Health Coalition. It's been around for a while, racial and ethnic approaches to community health, but there's a specific focus for this year. So Nicole Smith-Anderson, who's a special projects director at the Greater Flint Health Coalition, she's been here with us before. She's going to give us an update on what's available now in our community as a result of this funding.
Yeah, absolutely. Thank you so much for having me here again, Yvonne. And I think it's so important that we continue to have these COVID conversations. You know, it's not over. And so we're really excited to have this opportunity to kind of share this information. So if we go to the next slide, just to give a little bit of brief background, as part of the racial and ethnic approaches to community health, or REACH, COVID-19 flu funding that we received, the Health Coalition is really working alongside various partners to increase COVID-19 and flu vaccine uptake in the community. We've approached this a couple different ways. So one, we've held some focus groups, kind of getting some information about what the primary barriers are for vaccine uptake. We've worked really closely with community partners to complete some surveys. We've also worked with all these partners on the panel today. I think we've worked with or on a regular basis, but really working to increased vaccination opportunities. So making sure that there are no barriers, if at all possible, for folks to get vaccinated. And then also making sure that we're equipping those influential messengers. So we've talked a lot about making sure that we have accurate information, and, you know, we're able to have those conversations with people. And we're really proud and kind of excited about the next thing that I want to share if you want to move ahead. So one of the priorities that we kind of looked at as part of this project is really making sure that we engaged community partners and grassroots organizations in implementing this project. And, you know, I think it's so important, and we've learned over time the importance of having community member voices. And so we have been very lucky to be able to provide funding to all the entities on the screen, and they are helping to support our efforts around COVID-19 and flu vaccination. And it's so powerful and exciting because they're really all working in their specialty area, right? So, you know, we have Asbury that's doing work with their soup kitchen population. We have Revive that's going to be focusing on pregnant mothers. We have the McCree Theater that's going to be building in COVID information into their performances and having vaccination clinics on sites. You know, Empower's been doing some great stuff on social media. And so we're really just proud of these partners. And I think that they know their cohort and their community, and they're just doing such a wonderful job of sharing out that information. And we're just kind of getting going on these projects. And so you should expect to see more opportunities for vaccination and education coming out over the next couple of months. But I will say, you know, Dr. Reynolds said something really important earlier about making sure that we have accurate information and that we're sharing accurate information. And so I just wanted to add that all of our community-based partners have completed a vaccine hesitancy training course. So they are very well equipped to have these conversations. And we're really looking forward to, you know, them having these conversations, hosting these events, because we do think it's going to make a big impact in our community as we continue to work our way through this COVID experience. So I just appreciate the opportunity to share this information out.
Thank you so much, Nicole. It's great. We're seeing more and more community organizations being a part of these efforts, which also helps build capacity of community organizations, because this comes with some funding to do this work. So we appreciate knowing that. So for those of you that are listening, please reach out to these organizations, see how you can help, learn more about what they're doing, and let's be sure that we can encourage our community members to utilize these resources. Thank you so much, Nicole. Stay tuned. And if you have questions, I'll say again, if you have questions, please put your questions in the Q&A. This is so very important for us to respond to. I see a question in the queue from Mary, and I'm sure someone will answer that for you, but I know that the Latinx Center is being engaged in projects as to be a part of a number of other projects that are going on in the community as well. So if you're seeing somebody missing, please, this is the right thing to do. Put it in here so we'll make sure that we connect with those organizations. One of the other reasons when we're talking about things that are going on in our community, a portion of the World Health Organization's definition of health is that health is more than the absence of disease. And we know here in our community, we've had a number of issues that have been raised: pre-water crisis, post-water crisis, current water crisis. And one of the organizations that's been very, very helpful to us in our community is the National Resources Defense Council. Sarah Tallman is here with us today. And we also have another representative from the Natural Resources Defense Council, Jolie McLaughlin. They are on staff for this organization, but they have been diligently advocating on behalf of the residents of this community around the pipe replacement issue. So I'm going to ask them to come on this time and give us an update. This has been 7 years. You were one of the first organizations that filed a lawsuit in supporting of Concerned Pastors for Social Action. So can you give us an update of where things are and what our community can expect going forward? Jolie.
Hi, Yvonne. Yep. Thanks so much for that introduction. We're really excited to be here and provide an update to everyone and answer any questions people have. We will provide the update. Before that, we just wanted to provide a quick recap of the lawsuit. I I know there are a couple of lawsuits out there, so just wanted to remind everyone what this lawsuit is. So myself, Jolie, and Sarah Tallman, we are both attorneys at the Natural Resources Defense Council. We represent plaintiffs in a lawsuit that was filed in 2016 under the Federal Safe Drinking Water Act. The lawsuit was filed against the city of Flint and Michigan state officials. And this is the Safe Drinking Water Act is a federal law that imposes requirements on public water systems for how they treat and monitor people's drinking water to reduce contamination from lead and other types of pollutants. So our lawsuit that was filed in 2016, it sought to fix the problems of how Flint's water was being treated and monitored to make sure that the lead levels were reduced and that the city was going to fix the problem. And that included trying to require the government to remove the lead service lines at homes throughout the city. And our lawsuit was different and is different from the class action lawsuits. So those are also lawsuits that were filed against the government. However, those lawsuits sought monetary damages for all of the health and property harms that Flint's residents suffered as a result of the Flint water crisis. So in our lawsuit, we entered into a settlement agreement in 2017. So that was now about 5 years ago. And a key part of our settlement was that it required the city of Flint to replace the lead water service lines at occupied homes in Flint at no cost to residents. So it would be free for residents. And the state of Michigan agreed to pay $97 million to fund that service line replacement program. And under the settlement, the city of Flint is responsible for managing and implementing the service line replacement program. And what Sarah and my role and our other colleagues, what our role is really monitoring the city's compliance to make sure that it is complying with all of its obligations under the settlement, and monitoring the progress of the service line replacement program to make sure that all of the lead service lines that are identified are actually removed from the ground. And so the city of Flint and state of Michigan, they provide us with reporting on a regular basis, and we look through those reports and are in constant contact with the attorneys for the city and the state. So the service line replacement program in Flint, originally under the settlement, it was scheduled to be completed in December or in January 2020. However, that deadline got extended to December 2020 because of when the COVID pandemic happened, that stalled things. And then the parties had also identified more homes that needed to be that the city needed to go to check the service lines of those homes. So we extended that deadline. And then just this earlier this month, the parties, we agreed to allow the city to extend the deadline again to September of this year. And although we want the city to finish the pipe replacement program as quickly as possible, we know it's been going on for quite some time now, and we think it's important to have a deadline for the program. We also think the extension will make sure that if there are homes that haven't been checked, that the city will have more time to go to those homes. And that's ultimately what our goal is, to make sure that as many homes, those service lines are checked as possible. And it's also important to note that this new deadline, the September 2022 deadline, it only applies to the actual checking and replacing of the service lines. once the service lines at people's homes are checked, and if they're lead, then they're removed, the city still has an obligation under our settlement agreement to restore the holes that they're leaving in people's yards, and put the, fill it in, put the grass back, and restore it back to normal. So we understand that a lot of people have had holes in their yard for quite some time, and that can be very frustrating. And we are monitoring that situation. We're, going to be negotiating with the city of Flint, state of Michigan, a new deadline by which the city has to finish all of that restoration work. But that, you shouldn't be worried if by September your lawn isn't restored, because just note that deadline will be coming. It's just we haven't yet agreed to when the deadline should be. And then we also wanted to provide just a quick update on the status of the service line replacement program. So the vast majority of the city's work is already done under the service line replacement program. It's according to the most recent information we have from the city, about over 26,000 service lines in the city of Flint have been checked, and over 10,000 of those have been identified as being lead or galvanized steel and have been replaced with copper service lines. And in July of last year, the city set a deadline for when Flint residents need to sign up to participate in the program. However, that deadline does not apply to homes that have not received outreach yet from the city. As I mentioned, that the deadline has been extended to September of this year. And just to give some background for that, the city does need to, before performing work at a home and checking someone's service line, they do need to get the residents' consent to do that work on that person's private property. And so under our settlement, the city needs to basically visit the home at least 2 times to try to get that permission from the resident to do the work. And according to what we've seen from the data we've gotten from the city and its reporting, there are about 1,400 homes left that have not gotten those required visits from the city yet. And so this spring, the city will be required to go back to those homes or go to those homes and try to get those residents permission to check their service lines and then replace them if they identify lead or galvanized steel. And we are, NRDC is also working with Flint Rising, community organization in the city, to do a door-to-door outreach program to try to reach those a little over 1,000 homes, to make sure we could try to get those people to sign up for the program before the September deadline of this year. And then apart from those homes, there are about 400 homes left that they have given the city permission to do the work, but the city hasn't yet been able to schedule the work. So when someone fills in a form to give the city permission to do the work, or if the city goes to their home and gets permission, they still have to find a time to actually make sure that the resident is going to be home and to schedule the work. And so there are a few hundred homes where that resident has said, yes, please come and do the work, but the city hasn't yet done it because there are scheduling issues, and that work also will be completed this spring and summer. And then finally, we under the city's reporting have also seen that there's about 100 homes that have known lead service lines. So they've actually gotten the work done, but for some reason, an replacement has not yet taken place. So we're also monitoring those to make sure that those homes, especially because they're known to be lead or galvanized steel, that the city will go back and complete that work. So if you know anyone that has been trying to get in touch with the city or to try to get their service lines excavated or replaced, they should reach out to the city first. So, to check on the status of their home, to make sure that they can get the city to go back to their home before the September deadline. And on the city's website, there is a phone number and an email address. We can also share those in the chat here so that people have those. And then if you're unable to get in touch with the city, thanks, Sarah. Sarah shared that in the chat. If people are unable to, they don't hear back from the city, they could also reach out to us too, because as I mentioned, we receive reporting, we're monitoring the status of all the homes in Flint, so we can try to get that information for people if they reach out to the city and they don't hear anything. Sarah, do you have anything to add?
Just to respond to a question that I think Dr. Reynolds raised about homes where there is a renter and a property owner. So our understanding is that the city is reaching out to both the renters and the property owners if the property owner lives at a different address to get permission to conduct the work. So I think the city is responsible for reaching out to both parties. The renter has to consent because the contractor needs to come into their house. And then the property owner should be required to consent. So we know that there have been some issues with getting in touch with some landlords in the city. And so that is an issue that we are aware of to try to make sure that appropriate coordination occurs so that those homes aren't missed in that process. And if anyone is aware of specific renters that are having trouble getting their landlord's permission, please do contact us and we can help brainstorm to figure out additional ways if there's a problem getting in touch with a landlord or things like that, because we know that there have been concerns about that.
Thank you so much, Sarah and Jolie. And again, I'm going to ask our participants if there are more questions, please feel free to put them in the queue. They'll be here for the rest of the webinar to answer any questions that you might have. We thank you and appreciate you for bringing us that update. And keep in mind, as I said earlier, health is more than the absence of disease. And I just want to pull on Dr. Reynolds for a little bit because he asked that question. But also, he's also told us about the relationship between quality water and COVID. So Dr. Reynolds, I know it's a lot in this pack here, but briefly, make that link for us.
All right. One of the lines of defense or one of the tools against any infectious disease is being able to address personal hygiene and clean your eating utensils and cooking utensils. So you can't wash your hands without soap and water. You can use alcohol, but eventually we're all going to need a source of soap and water. And so the key is, how do we keep the water running? And that's where it's most important that if you have not heard from the city, you give the city a call and let them know your situation. And I might add, this also applies to getting a new water meter if you received a letter notifying you of that. But the bottom line is this: you've got to work with the city, and there are other nonprofit agencies in the city that will help you. And it's, I've given the example before, it's like smoking a cigarette while you pump gas. Nobody with good sense would do that. But to live in a house without water to take care of personal hygiene and cleaning is similar. And to say it hasn't happened yet is not sufficient. And we made this mistake before in 2017 during the hepatitis A outbreak in the region. So we're going to have to address the question one day: is water a human right? And I haven't seen a human live without it. Is water safe and affordable? And those are the things that we must address as a nation.
Thank you so much, Dr. Reynolds. And I just want to go back to end this conversation to Sarah and to Jolie, because as you mentioned, safe water. So there are still some community members that have not had their pipes replaced or had that checked out. And it's based upon what you're saying. I just want to get this confirmed. There are some homes that still may have lead service lines. So it's so important that our community members reach out to the city of Flint And then if not getting any response, reach out to you so they can have that done. I just want to make sure we captured that appropriately. I see your heads nodding.
That's right. Yeah. Thanks. And yes, we are more than happy to be a resource. Please, if you can, save our contact information that Sarah shared. We are more than happy to answer people's questions. But yeah, hopefully if you reach out to the city, reach out to the city first to get information from them.
Thank you so very much. We appreciate that. Oh, yes.
Just to add one other point, we definitely encourage people, if you're unsure whether you have a lead service line or whether there might be other lead containing materials plumbing inside your house, to continue to use filters that are certified by an organization called NSF. That's the National Sanitation Foundation, as certified to remove lead, and just make sure that you are installing and maintaining those filters properly so that they work. And the city is still providing free replacement cartridges for filters if anyone is in need of those.
Thank you so much. Appreciate you and look forward to additional updates as we go forward in the future. Now, this segues right well into our medical moment. Dr. Susan Wolford is going to give us a really clear understanding of an important concept. Dr. Wolford.
Thank you so much, Yvonne, for this opportunity to share on the topic of what has been in the news this week about COVID, particularly related to children, because I am very interested in what happens to our the youngest members of our population. And so this week in the news, you may have seen that Moderna wants to expand its use of its vaccine for children under 6 years of age. So I want to spend a little time on that this morning. And that accounts for 18 to 20 million children. So it's not a small part of our population. And so far, they have not been able to benefit from the protection of a vaccine against COVID. And so what they did is that they conducted studies looking at children 6 months of age to 2 years of age, and they had about 2,500 children in that part of the study. And then they also looked at children who were 2 years old to 5 years of age. And there they had about 4,700 children in that part of the study. And for the kids, they gave them, both groups got the same dose. They got a 25 microgram dose, which is about a quarter of what the adults get with the Moderna vaccine. And in both cases, the children got 2 doses, one dose, and then 28 days later, another dose. And what we want to look at now are 2 big questions that I am sure you are asking when you hear that kids might get a COVID vaccine and we're looking at such young children. So I imagine the 2 questions you want to know about is it safe and does it work? So let's look at the safety component for this. And so with the safety side, they noted that only about 17% of children got a fever, that is a temperature over 100.4 degrees. And less than 1% had a temperature over 104 degrees. It's actually 0.2%, so very, very small numbers that had high fevers, and about just 17% had a moderate fever, mild to moderate fever. And then they saw no cases of the myocarditis, that problem with the heart that had been seen in young adults. They did not see this in this age group, and in fact did not see any other severe problem. And so the studies seemed to prove that indeed the vaccine is safe for these 6-month-olds to less than 6 years of age. And then, does it work? So Moderna states that the vaccine at the doses that they gave these little ones produced the same antibody response as they've seen in older patients getting the vaccine. So that was also good news. And so they were able to say, check, it works. But I know by now in this pandemic, you are asking another question, right? It works, but it works to do what? What does it protect them against? And so here we want to look closely at the efficacy. So for the younger children, the youngest group, it looks like it's about 51% effective against symptomatic COVID. So against getting symptoms with COVID, right? So this doesn't speak to whether they may get infected or not, but getting symptoms with COVID, it was about 51% effective. And in the toddler preschool group, it was about 37% effective. Now, the big question that many may be still wondering is about severe illness and death. And they cannot make any comments about this because neither the group that got the vaccine nor the placebo group, the ones that, get the control where they get something that isn't the vaccine and they can compare the two, and that's how they do these studies. In neither group did anybody die, and there were not severe illnesses. So they can't make a comment about that. But we know that those instances are very rare in this age group, and that's partly why they could not make a comment about that. So they could tell that it protects against symptomatic illness with COVID. And these numbers, I know we're thinking to ourselves, when these vaccines came out in the beginning, they were talking about 95% efficacy, and now we're at 51 and 37%. And that is in large part because these studies were done during the time of Omicron. And we know that even in adults, the vaccine is not as effective against Omicron as it was against the original variant. But let's remember that flu vaccine is often around 40% effective as well. So these numbers are still valuable. All right. But it's important to note that it's not yet available. So the FDA has to investigate this, make sure that they think it's safe and ready to be used. And that process probably won't start until June. So we're going to have to sort of watch this space and wait to see when it becomes available. But there was other good news this week in that, for these young children, in that the FDA approved the first treatment for children under 12 years of age for COVID. And we know about this drug, right? We've all heard about remdesivir, and now it can be used down to children under 12 years of age, even in babies. And so let's just spend just a brief moment thinking about how this drug works. We've discussed this one before, so this is sort of a recap. So imagine that this bowl is our cell. And we know that viruses, COVID, like all other viruses, wants to make copies of itself. So let's imagine that it makes copies of itself by stringing together peppers and tomatoes that are already in the cell. So it looks at all the other things that are in there. It sees cherries, it sees walnuts, but it doesn't want those things. It needs to put peppers and tomatoes. And so it goes in, it finds the peppers, strings it on, and then it says, okay, what I need next, because it needs to be done in a particular order, what I need after the pepper is that I need to put on a tomato. It finds a tomato, puts it on, strings it together, and it makes a copy of what it needs to copy itself. What remdesivir does is it floods our cells with dates. And these dates confuse the COVID process of replicating itself. So now, when it goes to look for a tomato, it says, oh, I don't know, this looks like a tomato, but instead, because it's the same shape, it looks like a tomato, it confuses it. Instead, it gets a date. And when it does that, that stops the whole process, because for it to replicate, it must have pepper, tomato, and so on. And now instead, it's got a date. And it floods the cells with those dates. So what it's likely to find is in fact a date. It cannot replicate itself, and then therefore we don't get as sick. And in fact, we find it easier to fight the infection, and we do better. And so now for these young children, even down to 4 weeks of age, can in fact get, in fact 2 weeks of age, I believe, can in fact get remdesivir to help protect them should they get sick with COVID.
Thank you, Dr. Wolford. You maybe I'm just chuckling over here because we want to make sure maybe our children need to have a date with with the doctors so they can make sure that they get the ability to confuse those replicating viruses. So thank you so much for that. And we'll be looking forward to hearing more from you, Dr. Wolford. Please put those questions in the Q&A if you have them. We're going to move to Dr. Rick Sadler because, again, looking at reducing racial disparities, we have, as Dr. Deborah has always told us, we have to know what the data says, and we need to collect race data. So Dr. Sadler has been our resident expert working with the Health Department on the data dashboard. So can you give us the update on the race data, Dr. Sadler?
Sure. So I don't have any fun salad-based demonstrations. Show you a few multicolored graphs here. So this week in Genesee County and Flint, there wasn't a whole lot of a change. I did want to emphasize when we're seeing the slight upticks or slight downticks in case counts, whether that's divided by race as with the graphs on the left or overall, just a little bit of context on that. The rates that we were seeing in January of this year were actually 40 times higher week by week than they are currently, and 20 times higher than in April 2021. So just a little bit of context to hopefully alleviate a little bit of concern when we are seeing these little slight upticks, because it is kind of hard to remember what were those case counts per 100,000 over time. We're in a much better spot currently. The disparities don't seem like they're re-emerging at this time, but I wanted to make sure to kind of share that context so that we kind of had that big picture view. But we are still seeing a slight uptick in testing positivity rate. So it's, as I say, it's going around. Regionally, it's been increasing a little bit, and we may see that for the next several weeks or so. So it's not necessarily a time to totally let our foot off the gas.
So Dr. Sadler, you're saying to us, even though these are slight, they're still significant, and we should pay attention.
The rate of increase in the last week, I would not say is a significant increase. But I would say from a clinical significance point of view, obviously COVID is still serious. It's still very troublesome, particularly for the unvaccinated. So even though these case rate changes are slight, they could definitely still be impactful. So.
Thank you so much. I appreciate your input on that, Dr. Sadler. And now the Health Department, again, has been working in close conjunction with the Michigan State on these numbers. But Sherelle's going to give us the update from the Health Department today. Emergency Preparedness Health Educator. Help us be educated on this issue. Sherelle.
Well, hello. It's good to be back. It's been a while.
It's been a while. Welcome back.
Thank you so much. So on the screen right now, we're just showing the total cases that have been reported since the pandemic began in Genesee County, which is a little over 100,000 with 1,708 deaths. And you can also see that our women have become affected with the virus at higher rates than men. And we're also seeing a higher rate of infection in age groups 25 to 39. Next slide, please. So in total, with that being said, there has been 404,029 vaccines administered throughout Genesee County. More than 63% of the ages 12 and up population has received at least their first dose. So that is a great thing. I remember when we were trying to get to 50%, so met our target. And we do have our upcoming clinics as always. Today, Hasselbreen Senior Center is actually canceled. We just got notified of that, so wanted to let you know. But on Tuesday, on May 3rd and May 17th, we will be at Our Lady of Guadalupe. And as you know, that's alternating every other week on Tuesdays. And then Thursdays from 3 to 6 p.m. we'll be at Shiloh Missionary Baptist Church. And those Thursday dates are May 5th and May 19th. And then Saturday at the McCree Theater from 2 to 5 p.m., May 7th, May 14th, and May 21st. we do have those vaccinations available within the community. And then we have our good and faithful testing and vaccination sites within the community outside of the health department at Word of Life Church on Tuesdays and Thursdays. That is from 12 to 6 p.m. on Tuesday and Wednesday from 2 to 4 p.m. and Thursday from 1 to 7 p.m. Bethel United Methodist also offers testing and vaccinations. And then on Monday, Friday, and Saturday from 10 a.m. to 3 p.m., Macedonia Baptist Church has vaccinations and testing as well. Other testing sites include our local Walgreens on Davison Road from 9 a.m. to 5 p.m. Tuesdays and Thursdays. Every 10 minutes, you can go to Hamilton Community Health Network and receive some testing. And then in Source Creek, Sunday through Saturday from 9 a.m. through 5 p.m. Monday through Friday, 10 a.m. to 8 p.m. and Saturdays through Sundays, 10 a.m. to 5 p.m. at Rite Aid in Swartz Creek. There is also testing and vaccination available. And if you know anyone who is homebound and not able to get out to any of those clinics, you can give the health department a call and we'll be happy to assist them with testing and vaccinations by calling 810-344-4800. You can also visit our website at gchd.us.
Thank you so much, Sherelle. Appreciate those updates and specifically for letting us know when the things that we have scheduled are being canceled. We appreciate getting that immediate information from you. And let's move now to the city of Flint, get that update. Glad to have you here with us today. Lottie Ferguson, Chief Resiliency Officer for the city of Flint.
Yes, hello, good afternoon, everybody.
You got me today. Kiana. I'm sorry, it's Kiana.
No, it's all good. That's okay. We'll make it work. I hope you all are well. Just a few updates from the city of Flint, beginning with on yesterday, the city of Flint and its partners held a dedication ceremony for 6 women in our community and dedicated statues, which will be housed here at the city of Flint. On behalf of, again, 6 women who have been extraordinary in our community. Those women include Clarissa Shields, Edith Prunty Spencer, Dr. Mona, Frances Wilson Thompson, Olive Beasley, and Sybil Atwood. And so you are welcome to come down to City Hall during our hours. They are right out front in the lobby to visit with them, to take pictures, and to share out this really exciting effort. Want to again say thank you to the partners, including the Community Foundation, for this effort in celebrating the women of Flint and Genesee County. In addition, we're just about to approach May. May is Mental Health Awareness Month, and the Flint Recast is working in partnership with Genesee Health System to put on a number of activities. So please be on the lookout for those. In the meantime, if you are looking for any trainings, you can go to genhs.org and look under the tab where there are trainings, and there are at least 6 of them that are free to our community partners to participate in mental health training. They include Mental Health 101, Mental Health First Aid, and Trauma and Resiliency. So please go ahead and take a look at that website if you're interested in those trainings. And then finally, I just wanted to mention that the city of Flint announced at the beginning of the week the completion of the secondary water source. So the pipeline is done, and we are now a city with 2 major pipelines so that in case of any emergency, we would still have access to clean water. So the information did go out earlier this week. We are looking forward to sharing out even more with the community this really exciting news about having those sources.
Thank you so much, Kiana. And there is much more to come from all of our partners, and we'll look forward to some more detailed information about our water source going forward. We want to thank you all today for joining us for the Flint Community Webinar on Coronavirus. We want to encourage our community health workers and our social workers stay on quickly to receive your evaluation, to be eligible for those education units and your social work credits. Again, as we ask you every week, please remember to like us on Facebook, because we want you to come back, or you can go on and listen to the events, webinar again. If you need to get some additional information, subscribe to our YouTube channel, Healthy Flint, or please feel free to email us at info@hfrcc.org. We're always open for a call at 810-835-2130, and we're asking you, share this with someone else, and we invite you to join us again next week for session 112 next week. Thank you for joining us today.